Welcome to InfoKular. Today we'll be dealing with two interesting topics from dermatology. One is dermatomyositis, the other one is tuberous sclerosis. So if you don't understand it, it becomes very monotonous and difficult to learn and retain. So we'll go through pictures and let's make it fun and easy. We'll start with dermatomyositis. Dermato as in skin, myositis as in muscle, and itis is an indication of inflammatory processes. Now, it looks like an inflammatory process, but actually it is an autoimmune process, which shows skin rashes, muscle weakness, and this muscle weakness can be diagnosed through muscle biopsy or electromyography, whereas skin rashes, being very evidently, can be seen clinically, and hence dermatomyositis is important from dermatological type point of view. The treatment is corticosteroids, methotrexate, and azathioprine, but the exam questions comes from the cutaneous signs. He goes via New Main Street. He, as in heliotrope rash, goes for Gotron's papules or sign, via as in V sign, new as in nail telangiectasia, main as in M for mechanic's hand, and street as an S for Chagrin's patches. Let's see what these are. First, we see a person's hands, but the area is knuckles, and you can see lichenoid elevations. This typical picture is pathognomic of dermatomyositis and is called Gotron's papules. We have to differentiate it with Gotron's sign, which is erythematous areas over shoulders. Now, if you look at this flower, this is called the heliotrope flower. And if you look at the eye, if you look at the periorbital region here, you see a similar violaceous erythema. These patches are called as the heliotrope sign and has been named after these flowers. Next, we have the back of a person, nape of neck, and the lateral aspect of the shoulders. Now, erythema in such areas is called as the shawl sign. Similarly, if you see erythema on the front of the neck in a V shape, this is called as the V sign. Next, we see redness around the nails. This could be due to capillary dilatation. What do you call it medically? It is called as telangiectasia. So here we have nail fold telangiectasia. If you look at these pictures, you can clearly see the roughness, or medically hyperkeratosis. This uniform hyperkeratosis throughout the palms is called as mechanic hand. Along with this, calcinosis cutis also forms one of the important cutaneous signs. Now we'll see how these information is being relevant in exams. The question is, a 43-year-old man presented with ragged cuticles and papules on lateral forearms and knuckles. There is previous history of erythema in periorbital region. What is the most likely diagnosis? Now, because we have just seen the signs, it becomes easy for us to answer this question, but when you see it in the exam and when you see other differentials, you might get confused. Anyways, the cuticles here refers to ragged cuticles, could be hyperkeratosis along with nail fold telangiectasia. The papules could refer here because it is on lateral forearms and knuckles. So we are talking about Gotron's papules, and erythema in periorbital region, we are talking about heliotrope rash. So the diagnosis here is dermatomyositis. Let's move on to a very interesting topic called tuberous sclerosis. Now, what happens in tuberous sclerosis? This is also known as the bone wheel disease, not on the name of the chocolate, or bone wheel as such doesn't mean anything, but it is a French name, and this name, the scientist was Desire Bonneville from France, who deciphered tuberous sclerosis. Now, tuber in Latin means swelling, and sclerosis comes from Greek word which means rock. So basically what they are trying to say that this disease causes hard swellings. So this is a multi-system disorder. Now what is the main cause? Is that there are two genes TSC1, which is tuberous sclerosis 1, and TSC2, which is tuberous sclerosis 2. These two genes encode for two proteins. One is hamartin and the other one is tuberin. These two proteins together form a hamartin-tuberin complex. This hamartin-tuberin complex in turn is actually a switch for mTOR. Now mTOR causes proliferation of cells. However, in normal conditions, the HT complex is usually a switch off that does not allow the mTOR to function, and this does not allow proliferation of cells. In tuberous sclerosis, there is mutation at the level of TSC1 and TSC2, because of which the HT complex is altered. And this altered HT complex enables the switch to be on, and mTOR causes increased proliferation of cells. This in turn causes growth in all parts of the body. Now normally, let's say a tissue is made up of 3 red fibers and it is made up of 3 yellow fibers and 3 blue fibers arranged in this fashion. Now a hamartoma would be a tissue which is present at the normal location but in an abnormal way. If we make a knot out of this, you can see that the organization of the tissue is lost. Such a growth is called hamartoma. Now this kind of a growth, as you look at in the picture, is present mainly in the brain. So tuberous sclerosis is primarily a neurological disorder, cortical tumors being the most common manifestation. Others are subependymal nodules, hydrocephalus, subependymal astrocytoma and ependymoma. Heart में rhabdomyoma cause करते हैं, angiomyolipoma in kidney, liver, adrenals, pancreas, they all can be involved. Then why are we reading this in dermatology? Because जो दिखता है वो पता चलता है. So cutaneous signs are evident clinically, and hence tuberous sclerosis relies on clinical diagnosis with the utilization of cutaneous signs. Let's get started. This first picture, you can see that the location is nasolabial folds and cheeks, and there are papules, there are tiny sebaceous protrusions from the nasolabial folds and cheeks. This is called as adenoma sebaceum, again a pathognomic of tuberous sclerosis. Next we move on to, you can look at this leaf. If you look at the structure of the leaf and if you draw the structure here, you can see that the leaf resembles the hypopigmented patch on skin. This is called as ash leaf shaped hypopigmented macules. I purposely put in this leaf so that you can compare why the name has been put forward. Next, you can see, if you look carefully, you can see an elevation or thickening on the skin. This yellow thickening on the skin is called Chagrin's patch, again seen in tuberous sclerosis. A fibroma present in the periungual region, which is called as periungual fibroma or Conant's tumor. So these are the signs, these are the cutaneous signs in tuberous sclerosis that you need to remember. Now the questions are framed in a way where seizures, mental retardation and cutaneous manifestations are also seen, and the RX's treatment is usually anti-epileptics because there's so many of neurological disorders present. Surgery if there's any tumor that can be excised, chemotherapy if there is any conversion into malignancy, and psychiatric therapy for mental retardation and seizures and cognitive dysfunction. The question comes in the following way. Which of the following is a typical cutaneous manifestation in dermatomyositis? Now, this is a multi-pathology question. So they've mentioned calcinosis cutis. Of course, it is a cutaneous manifestation in dermatomyositis, but we can very clearly see there's something called as Gottron's papule on option D, which is more pathognomic. So we know that the answer is Gottron's papule, but there's also a terminology called as Chagrin's patch that is mentioned here. Chagrin's patch is seen in tuberous sclerosis that we've just mentioned, and salmon rash has been mentioned here. This is seen in Still's disease. And by salmon, they actually meant this color, which is called as salmon. So there are salmon-shaped, salmon-colored rashes over the body. That's about it for today. Hope you had a good learning experience. We'll see you again in another concept. Till then, happy reading.